All right, so let's get started. Thank you all for being here for our Get to Know CCC uh, webinar. We host this webinar every year for folks who are newer to CCC as an organization, who have recently subscribed and connected with us over the last year or so, to share a little bit about who we are as an organization, answer any questions about the resources, as well as highlight for you um, areas of our work, including what we're doing at the advocacy and the policy level, research and data work, as well as civic engagement opportunities that you have available and access to throughout the program year. My name is Carlos Rosales. I'm the Senior Community Outreach and Engagement Associate. I'm here as a part of the team who works to engage and connect with our extended advocacy network of over 13,000 individuals, and happy to answer any questions during this webinar and afterwards about ways that you can connect to our organization. So while I share a little bit about who we are, CCC, feel free to, in the chat, share your name and pronouns, the organization that you're coming from and your role, as well as a question that we have about if you can enact any policy at the city or state level, what policy would that be? While you do that, I just want to go over a little bit about who we are as an organization. Since 1944, CCC, or Citizens Committee for Children of New York, has engaged and mobilized New Yorkers to make the city a better place for children. And we do that by developing and refining our approach to child advocacy that is fact-based. And we do that so that way we can achieve our vision and mission of ensuring every child is healthy, housed, educated, and safe by advancing both issues around child and family well-being, equity, and justice for all of New York's children through the three different pillars of our work that you can see here. Over recently as well, especially in light of the pandemic and what has happened over the past few years, we also want to ensure that the work of our organizations continues to uplift the values that has been integral to our advocacy work thus far. And that includes values around ensuring justice, equity, integrity, fostering a community of belonging, and being accountable to the community that we're ultimately serving. That is New Yorkers and New York's families and children throughout the state. With that being said, today we're going to spend a little bit of time going through the three different pillars of our work. First, highlighting policy and advocacy that is occurring at CCC, followed by research and data resources that are available to you and that inform our advocacy work and what we do at both the city and the state level. And then to kind of close out this conversation we have with all of you here today, we want to share a little bit about the civic engagement opportunities available to you, both in the forms of programmings and different types of initiatives and events that you should be expecting to hear from us about throughout our current program year. So that, all that being said, welcome, excited to have you here. Like I said before, if there are any questions at the end of each of these three different segments, we'll pause to see if folks have any questions to ask of us. And if not, you'll always have a way to contact us following this presentation. So without further ado, I'll let Alice introduce our policy and advocacy team and share with you a little bit of the highlights about types of advocacy that we do, how we advocate, and our areas of work. So Alice, I'll pass it off to you.
Thanks so much, Carlos. Hi, everyone. My name is Alice Buffkin, and I am the Associate Executive Director of Policy and Advocacy at CCC. So as Carlos said, we at CCC often view the work we do in three pillars: our civic engagement, our research and data, and our policy and advocacy work. And here you can see our team of policy and advocacy advocates. There's myself, Geneva Lowe's, Juan Diaz, Rebecca Charles, and Caitlin Passaretti. And you'll hear in a moment from all of them about the work that they're all covering within their issue areas. But broadly, in terms of how we view our policy and advocacy work, CCC does our advocacy work at both the city and the state level. So we really view it as our mission to identify the issues that most impact children and families at the New York City, at the state level, whether that's in child welfare, youth justice, education, housing, behavioral health, and really push to change the state and the city level policies and budget decisions that are made and advance priorities that support and help families and children thrive. Much of the effectiveness of our work is due to the strong collaboration and partnerships we have with different people throughout the city and the state, whether we're talking about educators or providers or family members, youth, other advocates. We both lead and participate in a number of coalitions throughout the state that are fighting for a range of issues that are intended to support children and families. And in a minute, we'll actually walk through at a very high level some of the key priority areas that we are collectively focusing on. So both as an organization and as part of coalitions, we, sorry, Carlos, we're still on the previous slide. As an organization, as a part of coalitions, we conduct activities to really change the conversation at the around policies at the city and the state level. So this includes a lot of traditional advocacy elements. Many of you might be familiar with things like attending and testifying at hearings, conducting rallies at the city or the state capitol, meeting with elected leaders, mobilizing take action campaigns. We also view it's really important to heavily engage the media in the work we do, because we have to shine a light on the issues that are impacting children and families. We need to elevate family voices and those of impacted people in sharing their stories and helping the public understand, what we need to be supporting as a city and a state. And we also produce, a number of different products designed to really shine a light on the issues, whether that's data products or policy briefs or things like letters in response to different proposals from our city and our state leaders. And collectively, our aim is really to educate and mobilize the public around key issues and put pressure on elected leaders to do better and to recognize that we have a lot of needs in the city and the state. We desperately need to invest in the policies and the budgets that help make our community stronger. And we really want to drive that work forward through the work that we do. So Carlos, if you want to jump to the next slide. So I think at a very high level, we're going to walk you through some of the key issue areas we're focused on, but we are always happy to talk in more detail. Our contact information is on our website if there are issues that are particularly relevant to you or to the work you do. So I'll touch first on some of our work around behavioral health. I think it's impossible at this point to underestimate the depth of the need in our state when it comes to the mental and emotional well-being of children and families. A lot of these issues were here well before COVID-19. We were seeing a rise in children in crisis, a rise in anxiety and depression among youth. We were seeing increases nationally in youth suicide, particularly among Black youth, and real stories of inadequate support and provider capacity in New York City and across the state. CCC does a lot of our work in this space with a coalition called Healthy Minds, Healthy Kids, which is a statewide coalition of providers, of advocates, of family organizations, really aiming to ensure all children have access to the behavioral health supports they need. So within that work at a high level, we're really focusing on having a sustainable system where no matter how old you are, whether you're a very young child, whether you're a young adult, whether you are in need of preventive services to make sure that more intense needs don't emerge, or whether you are a child with really acute and complex needs and you need more long-term and crisis services. We want that full continuum of supports to be available to all children who need it. We also need to look at the workforce, the fact that, both upstate and downstate, we have wait lists of hundreds long, and we need to make sure that we have more providers, more BIPOC providers, more bilingual providers coming into the system. And in schools, we need to recognize that we have a punitive approach in far too many of our schools when children are experiencing emotional or behavioral health needs. We need to shift that so that we're instead providing the supports they need in schools so that all children are being supported from the very first day and are getting the level of care they need, whether that's in a school, in a clinic, or a community. So with that, I'm going to turn it over to my colleague, Ginny, who's going to speak to some of our other health priorities.
Thank you, Alice. And another health priority is our early intervention work, which we want to make sure that all children with developmental delays and disabilities from birth to 3 are getting the services that they need to thrive. And we work with a coalition, Kids Can't Wait, where we are advocating to address provider service shortages. What we are seeing is that many families and many children aren't able to get the services that they need because there is a shortage in providers. And we are advocating for an increase, a rate increase, so that there are more providers available for children who need them the most. And we want children and families, obviously, to continue to be, we want children and families to thrive and be able to access these services, because children should be able to get the services that they need when they need it. We know that there hasn't been a substantial increase for providers in years, and we are working through Kids Can't Wait to make sure that we advocate on a proper rate increase to make sure that children are getting the much needed high quality services that they need during this critical time. We are also working, especially on the city level, regards to childhood lead poisoning. We know that there is no safe level of lead for children. And we also know that children in lower income communities are at risk the most in regards to childhood lead poisoning. So again, working through coalitions and partners, we are working to pass a package of lead bills that would require landlords to produce records of annual inspections whenever HPD, Housing and Preservation Department, issues a peeling lead paint violation. We want to make sure that landlords, management companies, building owners are abating lead on friction surfaces, which are doorways and windowsills, which especially in rental units with children under 6. We want to make sure that peeling paint in common areas of rental properties is a Class C violation, which allows families and children who have been lead poisoned to be able to sue building owners and management companies, holding them accountable. We also want to require the DOHMH to produce quarterly reports whenever landlords contest a lead violation, and to make sure that there's transparency in why they are contesting that. All of this is to enhance and strengthen current lead laws, and to make sure that future lead laws are able to make sure that children are healthy and comfortable in their homes. And we are also working on combating food insecurity. On the state level, we are working with partners in support of a universal school meals for all New York State children. We know that when children experience hunger, they struggle to focus, they have lower attendance, and are at greater risk of mental and physical health problems. And ensuring that all New York City and state children have quality, healthy meals, we know that that will improve academic achievement, that will improve attendance and classroom behavior, and it also reduces the longstanding racial disparities in nutrition, health, education, and achievement. And with that, I will pass it along to my colleague, Juan.
Thank you, Jenny. Good afternoon, everyone. Yes, as you all know, the housing crisis in New York City requires immediate attention. That's why CCC is part of the Family Homeless Coalition. You know, it's a coalition of 18 organizations representing service and housing providers and children advocacy organizations united by the goal of launching a coordinated, collaborative, multi-agency effort focused on preventing homelessness, improving the well-being of children and families in shelters, and supporting the long-term housing stability of families with children who leave shelter. So there are different components to housing. One of them is prevention for those who are in the community, making sure these families, when they fall into rental arrears, where they owe rent or utilities, the city government is there to help them. Those who unfortunately have to enter shelter have the resources and the assistance from the city to exit shelter in a timely manner, and also making sure that the city sets aside sufficient number of affordable housing in the city. One of the, if not the most present campaign that CCC is currently working on, I'm going to share the link shortly, is to eliminate the 90-day shelters to stay rule. Currently, there's a rule, program rule, it's not even a law, that requires families and individuals who are currently in shelter to stay for 90 days to become eligible for CDFAPS assistance. CDFAPS is a city-funded and state-funded housing voucher that was recently increased to Section 8 maximum rent levels. So these families have to stay, as you can see in the graph, how since 2020, the length of families with children staying in shelter is now at almost 17 months. And part of the reason of this long stay is the requirement for families to stay for 90 days before they become eligible. After those 90 days, families have to come up with documentation, pay stubs, income, proof of income, and that can make another month. And then you add the barriers, the administrative barriers, the income discrimination that happens in New York City constantly, and the city government has the capacity to eliminate this rule, which will create more room, more space for families in need. As of early this week, the shelter population in New York City exceeded 62,000, which is a record high. Over 18,000 asylum-seeking families have come for assistance, which has only exacerbated the need to create more space. So CCC and our coalition, the Family Homeless Coalition, we're constantly submitting testimonies. We're constantly releasing press releases, letters to city government officials. We're constantly having meetings with officials to act rapidly in a manner, to create a voice for those who don't have a voice. That's what CCC is here for. We also advocate for the elimination of barriers with subsidies approval, making sure the family has, the city has enough personnel to approve these applications. And we also are pushing for the expansion of eligibility. There's many requirements to be eligible for CDFAPS. And one of them is, for instance, families have to have a shelter history or have been evicted have been taken to housing court within the last 12 months. Those are requirements that the city can eliminate to help those families, especially those who fall through the cracks. Also, the city has the capacity to, working with the state for funding, to expand CDFAPS for undocumented families. So this is something the CCC is constantly working on. And at the state level, the state is a big factor with city politics because they control many of the budgeting aspect. CCC is also advocating for a statewide subsidy that will cover more groups, including those children exiting the foster care system, undocumented families, and this in the coming months, CCC will be actively working on, and that's why we ask for your support. And I'm going to share here the link of the 90-day rule, right? So you can click on it and sign if you support this rule. And now I'm going to pass the microphone to my colleague, Rebecca.
Hi, everyone. Thanks for joining us today. My name is Rebecca, and my pronouns are she, her. Can you all hear me? Oh, okay. And I'm the Policy and Advocacy Associate focused on early childhood education as well as K-12 education. So I'm just going to go over briefly some of our high-level priorities with ECE. As you can see over here, I use this data point on cost burden and affordability. 93% of families with young children cannot afford center-based care using a federally recommended threshold that cost does not exceed 7% of household income. So that's within New York City, 93% of families cannot afford center-based care. So one of our major priorities with childcare, both on the city and state levels, is expanding access to childcare. That means that we believe at CCC that every child and family should have access to childcare and childcare subsidies, regardless of income, employment, or immigration status. So a big one of our big childcare campaigns is the Campaign for Children. That's our city level coalition, and we focus on expanding childcare at the city level, which means also expanding the system. So right now, there is a birth to 5 system, but unfortunately, it's not a universal system. So most infants and toddlers do not have access to center-based childcare in the city. And so that is one of the things that we're focused on, is aging down that system and ensuring a truly universal birth to 5 system. And another thing we're focusing on is expanding the days, the hours of childcare. So currently, most childcare in the city is only offered during school day hours and the school year calendar. And that's problematic for families for obvious reasons. Employment hours usually go past childcare hours. And also families need childcare year round. So one of our other priorities is focused on year round, all day care for families. And then at the state level, we're really just focused on, oh, I'm sorry, I forgot one major city priority is supporting providers. Right now, this is a really huge focus for us because providers have still not been paid adequately from fiscal year 2022, which means basically that means providers are contracted by the city, and the city is contracted to pay providers, reimburse them for what they spend on providing childcare. And the city has yet to do that for last year's fiscal year. So that's a really big issue right now. And we're actually organizing a rally right now that you all will hopefully get more information about in the coming days. But that rally will take place on next Wednesday, the 19th at noon at City Hall. And so that at the state level, we have very similar focuses, looking at supporting providers and expanding childcare at the state level. And one of our big priorities this year is ensuring that all families, regardless of immigration status, can receive childcare subsidies, because currently that is not something that can happen in New York State. Families who are immigrants or undocumented have a lot of trouble accessing childcare, or are often just excluded from childcare subsidies altogether. I'm going to move on to our K through 12 priorities. These are a lot more broad right now. So we're focused on really just marginalized groups within the K through 12 space right now. And that includes students experiencing homelessness, multilingual learners, and students with disabilities. A lot of work has been done in the last year, especially around students experiencing homelessness. We have secured community coordinators in our shelters, which they serve as liaisons, academic liaisons for the students who are experiencing homelessness. And they really focus on attendance and ensuring that those kids can get to school and get all the academic supports they need. Right now, there's obviously also, as Juan kind of mentioned, a migrant crisis, as we all know. So we have an influx of multilingual learners coming into the city, and a lot of our priorities are going to be focused on ensuring that they have the language access supports that they need. And of course, students with disabilities, we're focused a lot on preschool special education and early childhood education. Students with disabilities, ensuring that they get the supports that they need and that they also have a school that they can go to. Many students right now actually don't have a place to go to school that would serve their needs. And then finally, we're working to end the school to prison pipeline. One of our big legislative asks this year is the solutions, not suspensions bill at the New York State level. And that would be working to end harmful disciplinary practices, working to reform code of conducts at schools, and really including restorative approaches to discipline, and changing the amount of days a child can be suspended, and also limiting the use of suspensions from kindergarten through 3rd grade. And I think that's a good segue to move to my colleague, Caitlin, who covers our SAFE portfolio.
Great. Thank you so much, Rebecca. Hello, everyone. My name is Caitlin Passaretti. I'm also a policy and advocacy associate holding the child welfare and youth justice portfolios. And I also use she, her pronouns. So as you can see, our other pillar, Keep Every Child Safe, focuses on child welfare and youth justice. In this space, we work mainly with 2 coalitions, the Child Welfare Financing Coalition and the Raise the Age campaign. In the child welfare space, we are working to ensure that every family has their needs met and that we fund upstream primary prevention resources such as housing, tax credits, making sure diapers are accessible, that every family has broadband internet, behavioral health needs are met, etc., to minimize any interaction with the child welfare system. Unfortunately, we also have to recognize that the reality is around 9,000 children are currently in the foster care system right now. And so we need to ensure that there is funding for children and youth in the system to receive the care and resources that they need. New York has also made great strides with the youth justice in the past 5 to 10 years. In 2017, New York passed Raise the Age, which means that 16 and 17-year-olds are no longer tried and prosecuted as adults, which is huge. It was just New York and North Carolina who were the only 2 states who still tried 16 and 17-year-olds as adults. And we are advocating to ensure that the $800 million that has been allocated for Raise the Age implementation is actually being dispersed to counties so that counties can implement different forms of youth programming, alternatives to incarceration programming, and making sure that youth development services are available within their detention centers. As you can see, upstream prevention is incredibly relevant in both the youth justice and the child welfare space, and to ensure that young people live well-resourced lives where they can access housing, healthcare, behavioral healthcare, sports, art programs, and other activities. We fully believe that safety means that communities, families, and children have the resources and services that they want. And it's our job as advocates to make sure that we can tell elected officials like what we've been hearing on the ground. And so with that, I'm going to pass it to Juan and Jenny, who will discuss the importance of ensuring that families are economically secure.
Thank you, Caitlin. Yes, so CCC works actively with a local asset work group to improve the economic well-being of children, families with children. As you all know, the COVID-19 pandemic left deep marks on families' economic insecurity, which leads to many other aspects of suffering in housing, education. So CCC is actively advocating for the state to keep the earned income tax credit that was funded for 2023 extended to 24, making sure that this is permanent. Same for the Empire State Tax, which, however, we're advocating to include children since they're born. Right now, the law only allows children over 4 years old. Also, with so many guaranteed income programs going around the country and the city, there's a legislation that only needs is the governor's signature to pass to remove guaranteed income resources from entire benefits calculation, so families do not lose their cash assistance and other safety net assistance. As far as improving childcare services, also the city needs to create a better system of paying providers. Many of them have not received payment in months. And also we applaud the inclusion of $10 million in the city budget for this year to fund universal childcare for undocumented families. And we're looking to advocate for the extension of that and to include everyone, universal childcare, which is, as of, I believe yesterday, there was a rally in the city hall, and we call for everyone to support this as well. So now I'm going to move on and pass it over to my colleague Maria, who is going to talk about CCC's research and data program. Maria?
Thank you, Juan, and good afternoon, everyone. My name is Maria Drobnik, and it's really my pleasure here to be in front of the 4-member research and data team at CCC. Our collective expertise really spans from analyzing public data, performing statistical and geospatial analysis, participatory work, survey design, and in-depth knowledge across several issues areas that my colleagues just spoke about. And I'll say that in addition to supporting our own advocacy and our own policy and advocacy work and efforts, we are maintaining really strong ties with other service providers across the city or with other advocates who are actually using our tools and publications in their own advocacy, in their own work. And on the next slide, you can see just like a brief overview of several data tools and publications that we produce. So they kind of vary from annual and biannual publications to our community-based assessments. We produce infographics and data briefs to support directly our policy and advocacy work. And we also have an evergreen online database, Keeping Track Online. So I will share more details about each, but before I do that, I would like to walk you through some of the data sources and techniques that we use on a daily basis. And really those go from US Census data. On the next slide, Carlos. Yes. So the data we use goes from US Census data, from state and local administrative data, including geospatial data, and also very important community data. So in terms of the census data, we mainly use, on the next slide, we mainly use American Community Survey, 1-year and 5-year estimates of population for the city, borough, and PUMAs, which really are aligned with community districts and community boards. So here I included a map of those. I believe that you're familiar with them. In 2020, census had many challenges with estimates because of the low response rates during the pandemic. However, 2021 estimates are reliable, and some of them are published already, and we will be able to see them on our database in the coming months. In addition to census data, many of our data are coming from local and state agencies. We obtain this data either through agencies, like through open data portals, but we also obtain them through like agencies' websites, and really important through like individual data asks. Like in many cases, we really need to request for the data, and having our database being like the only place where public can find the data. We really believe that public data should be public. And in addition to publishing the data on a site, like every time we are making this ask, we are pushing agencies for more transparency with the data. On this slide, you can see a couple of agencies, like it was from Department of Education, Department of Homeless Services, Administration for Children Services, and you have some sample indicators on the right side. And when it comes to community data, we use several techniques. So we developed surveys, which in the last few years we piloted as via SMS. We are also doing listening sessions, focus groups, mainly with parents and caregivers, but also with service providers and also with youth. And we also have community events and town halls. Our most comprehensive effort to get community insights is through our community needs assessment, and I'll talk about those in a bit. But in addition to that, we continue to use these tools for other projects. So last year we piloted and we launched a Voicing Our Future survey via SMS, where we got in touch with more than 1,300 youth in the city. And we are currently working on 2 qualitative projects using listening sessions and surveys to get more information about needs, about the childcare needs of parents and caregivers in the city. And coming back to our publications, on this slide, you can see that Keeping Track of New York City's Children Data Book is publication we published since 1993. So it was there way before we launched our Keeping Track Online database. And it really was a desk reference showing like trends over time, citywide trends, borough-wide trends that we produced over the course of 4 decades. And in this last edition, so you can see that on the next slide, that we published in April, we highlighted trends that emerged during COVID-19 pandemic, but also key data trends about housing, health, economic security, education, etc. And one very important part of this publication are these geographic profiles, where for each community district in a city, also for 5 boroughs, we have like more than 24 of indicators there. And what we did in this past publication, we also included assets, a location like of banks, parks, supermarkets, really to illustrate what communities have or don't have at their disposal in proximity to where they live. So it's more meant to really spark that conversation. A lot of the data that is available for communities are deficit-oriented, so really highlighting the assets and where they are really complementing the experiences of families is very important. And on the next slide, you will see another publication that we produce annually is a Child and Family Wellbeing Index. Within this index, we analyze around 18 indicators across multiple domains of child and family well-being to identify barriers and opportunities for well-being that families are facing. And what we learn from this analysis is how children and families in some areas are more likely to experience barriers, and in some they are not. And there is really not anything about inherent differences between different groups, but it's really more about disinvestment and discrimination over decades. What we are aiming to do this year is really to reflect back on the index, both in terms of the methodology, the indicators that we use, but also in terms of the language that we use. We are trying to enhance like how this tool is promoting monitoring equity in outcomes over time and how it is promoting equity, promoting language. And I think some of you expressed interest to be part of this conversation. So we will be definitely in touch on this in the coming year. And on the next slide, you can see all 18 indicators that are currently making up the index, and you can explore them at your own time. And we have this index available on our online database. And speaking of the database, we launched the database back in 2012, and currently it has a couple of tools, but the main one that's where you can explore more than hundreds of indicators is called Explore Data. We really are breaking down data wherever possible by race, ethnicity, by gender, by age, by different household characteristics. We have the data available in majority of cases by community district, but some indicators are available by zip code, by a police precinct, by school district. Every indicator is available by borough and citywide, of course. And data in some cases goes back to 1993. So it's really, we are maintaining the database and updating indicators whenever data does become publicly available. So you have data over time. And currently on this slide, you can see the map by community district, but you can explore the data via table, via bar chart. And there are a couple of other tools. You can also explore the Child and Family Wellbeing Index on Keeping Track Online. And we also have a separate tool, Map Community Assets. If you scroll to the next slide, where we actually are showing assets by like their locations. And we have like more than 36 of assets. Maybe Carlos, if you click once again, you will see the map. Yes, so we have allocations of all the assets across like housing support services, financial support services, banks, medical facility, mental health facilities. And the whole tool is really meant to spark the conversation and to identify areas where there is a scarcity of services or where there is abundance of services. I think on this page, you can see different educational assets like pre-K sites in CBO centers, for example. If you hover over any of the indicators, like Carlos, I think you can stay on the slide for a moment. You can see more about individual assets. And something to say about Keeping Track Online more broadly, all the data can be downloaded in a CSV file or Excel files, so you can explore them and use them for your own work and analysis. You can also share the data via Facebook, via email, and we are always more than happy to come and do like demos and trainings on the tools. So feel free to be in touch with us, and there are other folks that you think would be interested. We are always there. The tool is free to use, so and you can see more about the sources and methodology on the About section over there. And you can move on to the next slide. So I mentioned earlier our community-based assessments, which are typically a year-long projects where we focus on single community and we combine findings from analysis of public data, our asset mapping, and then community engagement like these community voices of residents. Between 2017 and 2019, like end of 2019, we did 4 in a city, 1 in Brownsville, Brooklyn, North Shore of Staten Island, Northern Manhattan, and Elmhurst, Corona. We completed that one just before the pandemic. And I will say since the pandemic, we haven't done these type of assessments, but we continued with this same approach to support different projects and initiatives that can be like topic specific. So like during the pandemic, we worked with the preventive service providers really to identify what are the needs that they were experiencing while supporting families. So we did the work with the city preventive, child welfare preventive providers, and also statewide. And I mentioned that we are doing currently needs assessment and like elevating voices in the childcare space and like understanding the needs of families and caregivers. And on the next slide, I highlighted a couple of other products. I mentioned that we are producing infographics and briefs. They can be about 1 page or 2 pages or more elaborate publications. So for example, in 2019, in collaboration with our partners, Advocates for Children, we produced a report of inequities in early alert system. So it's really important, and we really use the report in our advocacy and illustrating the gaps. Rebecca mentioned the childcare affordability and how 93% of families cannot afford center-based care. We produced the analysis of childcare affordability back in 2020, and we will be updating it when the data becomes available. And we also did in 2021, for the first time, child and family well-being in New York State index. We used a similar approach as with the citywide index, where we have a set of indicators, and we will be updating that one with the new data. And also we produced index this year on children under 5, like focusing on community conditions that are really making children thrive and getting them ready for school. So all of these publications are available on our website and many more. And I think with this, we can go to the next and the last slide, where I'm outlining just a couple of projects that will be unfolding in the coming year. So I mentioned the qualitative project on elevating the voices of parents and service providers to improve access to early care and education programs. This qualitative project is really building on a long year effort that we placed on analyzing and monitoring publicly available data on enrollment and capacity in early care and education systems. So it's really building on admin data, but combining it with parents and service providers' voices is really important. So this is what this project is about. So it's consisting of, we did listening sessions over the summer. We'll be piloting survey during the fall, and we'll be sharing the findings. We will also be having our annual fact sheet using 2021 census data, focusing on housing issue and supporting family homelessness coalition. So it will be coming in the next 2 months. I mentioned already Child and Family Wellbeing Index in New York State, and also Child and Family Wellbeing Index in New York City. And with this addition, we are hoping to incorporate any findings that arise throughout the process on discussion how to improve the tool and monitor and promote equity. So with this, I'm wrapping up the research and data section, and I really invite your feedback and your thoughts, and to stay in touch with us if you have any thoughts about the tools that I just spoke about. And I can pass it on to Carlos.
Great. Well, thank you so much, Maria, Alice, Juan, Caitlin, Rebecca, and Jenny. Appreciate all this wonderful information you've been sharing with everyone here. Before we talk about civic engagement and the opportunities available to you to engage with us as an organization, I wanted just to pause to see if anyone had any questions about content that was shared around our policy and advocacy priorities and agenda and the areas of work that we were focusing on, or if there were any questions you had related to research and data, whether they be the publications or the different tools available to you. So I'll take a minute or two to see if anyone has any questions. You could type it in the chat, but also feel free to unmute yourself and just ask aloud. So I'll pause now and see if anyone has anything to ask.
Hi, y'all. My name is Adonich Mackey, she, her, hers pronouns, and I'm the Director of Civic Engagement Advocacy at Jumpstart. Our focus is early education. We also do some work concerning like AmeriCorps and service learning and federal work study. But what I was wondering was, where do you all see, are you looking to partner and work with other organizations on your policy efforts? Are you looking to build a coalition efforts? And if so, if we were to get in contact with folks, like, do you want us to get in contact with like Carlos, everyone, or like certain specific folks? For example, Rebecca seems to be the one, or is the one over at ECE. How would that work?
So I could start, and then Alice, I'll have you jump in to elaborate more on the different coalitions and works to engage there. But I would say yes, you can absolutely rely on me as a point of contact. Usually I provide myself and direct any communication about ways folks want to engage to our policy or research and data team. But I'm sure our team members aren't hesitant to share their email and contact information as well if you already know what specific area you want to connect with us on. So feel free to email me. I'll have Maria, as well as the policy and advocacy team, provide their contact information in the chat, and they'll just write down what their policy areas that they focus on next to their contact information. But yes, we have a number of different campaigns and coalitions and some opportunities that I'll be sharing in the next couple of slides specifically to engage with us in that work. One that stands out is around our Healthy Minds, Healthy Kids campaign and leadership councils that we're forming to engage both providers and community members with lived experience, both youth and adults, in our work around mental health and behavioral health. But I'll let Alice jump in here to elaborate more on connecting with our other coalitions and work there.
Thanks, Carlos. I mean, I think you largely covered it, which is, yes, we absolutely want to talk to, everyone about issues they're working on, find ways for collaboration. I think we view the strength in our work and knowing that no one organization can, handle everything, and we're strongest when we are partnering with others. So I'd say definitely reach out. Our staff is not so big that if you don't get to the right person, we won't immediately, connect you with the right staff member. So we're very happy, all of us. Carlos is a great contact, but as he said, we'll all include our email information in the chat so people can use it. But always feel free to reach out, and we'll always try to connect you to the right person within the staff.
And maybe Carlos, I was about to jump in because we have a project that is going on in the early childcare space. I'll drop my email. Feel free to be in touch because we are seeking opinions and thoughts from providers and other organizations while developing survey and while really thinking about policy priorities in the coming year.
Thank you, Maria. I'm going to drop mine in the chat as well.
Yeah.
Okay. Thank you for that question. Any other questions from folks about what we shared so far? Give it another 5 seconds or so to see if anyone wants to unmute. Okay, well, I'll pause again at the end to see if anyone else has any more questions, but let's go into talking a little bit about civic engagement at CCC and opportunities available to you with a number of different projects that are underway. So broadly speaking, CCC Civic Engagement Division focuses on building relationships and partnerships with different organizations, providers. In many ways, we coordinate and collaborate with projects that are underway in our research and data team, as well as in our policy and advocacy team, as well as was just illustrated here a few moments ago. But we are also focusing on mobilizing our community of advocates that we've been engaging with over numerous decades. Oftentimes, the folks that do connect with CCC end up being sometimes lifelong partners and have worked with us over several decades. And we are always continuing to think about how we can form new relationships and new partnerships so that way organizations interested can participate in our work, but also think about how do we make sure we mobilize and create a community of advocates that advances not only the mission and the focus that we have, but the broader vision of making sure that children, young people, and families across New York has the support that they need so that way their well-being needs are met. And so to highlight a number of different programs from a programmatic perspective, first, we have a community leadership course that is a 10-week course offered every fall. That is the opportunity for folks who are providers, or sometimes we have students as well, and different community advocates to really do a deep dive on different issues impacting families and communities throughout New York City and New York State. Since it's in the fall right now, we have our current 2022 cohort actively participating in the course where they're learning about different policy and advocacy issues, bringing in both the lived experience, the research and data, and the advocacy work that's being done, and can include different topics such as child poverty, child welfare, juvenile justice, family homelessness, education, youth services. And the way the course is designed, it's usually has both a learning component and an engagement component in which folks participating think about how the resources, tools, and areas of expertise that we bring in can help contribute and support the work that they are doing themselves, whether it be whatever type of advocacy that they are a part of. And so applications usually open up again for each cohort in the late spring and early summer. And you can definitely reach out to me if you would be interested in being a part of this course for the 2023 cohort, and I can make that connection when applications open up again. We also specifically focus on mobilizing and engaging youth through our Youth Action NYC program. This is an after-school program that teaches high schoolers how to engage in fact-based advocacy, and is a way for them, especially if they're unfamiliar with advocacy, to get involved and learn about the role young people play, and also give an opportunity for youth to uplift their voice and engage not only in our advocacy, but connect with their elected officials, elected leaders, and their peers around advocating on issues that are important to them. And so there's a different programs that are part of this broader program. We have a Youth Action NYC internship program that is a year-long program teaching participants tools of effective advocacy and how to analyze data, as well as conduct research and engage their own communities. We have Youth Action members, which is essentially after completing the internship, they essentially graduate and are invited to develop their own youth-led advocacy campaigns. And I'll highlight some examples of what that looks like soon in the next slide. And then there are also peer trainers. And so for youth who have been involved with us over the course of a few years, they are selected to participate in a peer training type of program where they go out and meet other youth and engage other programs throughout New York City. So that way they present and they help develop their capacities to also engage in advocacy. So it's a peer-led program that's designed so that way youth are working with youth to engage a wider network in this work. And I see a question in the chat. Yes. Let me see. Jacqueline, is there an age limit? I don't believe so. Currently, the CLC that we're providing is mixed, it's hybrid. So there are some in-person elements, but there are also a lot of days where we're just meeting virtually. I can talk a little bit more about this afterwards, Jacqueline, to get more specific about which training or which course you're talking specifically. To highlight some of the youth work that, there we go. To highlight some of the youth work that we've been involved with, an example of this is the NYC Youth Agenda. And this is a partnership between Citizens Committee for Children of New York, the CUNY's Intergenerational Change Initiative, YVote, and DYCD, We the Youth Advisory Council. And they've been working on really elevating the voices of youth and uplifting what their priorities are that will shape New York City in the decades to come. This emerged after we've gone through a process of surveying thousands of young people that Maria highlighted before about their concerns and priorities for elected officials in the run-up of the last election. And since there, we've developed this youth-led partnership so that way we can create this NYC Youth Agenda. And I'll make sure we'll share these links with everyone afterwards, but you'll see in the links below some of the surveys as well as the resources that inform the creation of the youth agenda that we're now advancing through this partnership. Then another area in which we have opportunities for engagement is around the Healthy Minds, Healthy Kids campaign. We are currently focusing on elevating the voices of communities and young people to think about how are we going to create a movement in which community advocates and youth are fighting to improve access to mental health and behavioral health supports for children across New York State. This council is going to be a group of 30 who will then engage in a wider network around different types of advocacy and budget policy prioritization to make sure that the mental health needs of New York's youth and children are met. The application is still open. The deadline is nearing, I believe it's this Sunday, October 16th. But if anyone here is interested, or you know someone that is interested in being a part of this or learning more, have them connect with me sooner rather than later. And depending on their interests, we may be a little flexible with the deadline if needed. And then I can briefly go over this, but Maria covered a lot of the major publications. I've just made sure we hyperlink some of them here for you all, so that way you have access to them. And then lastly, I just want to highlight that later in this month, we have, and into November, we have two upcoming events, one focusing on youth justice, which is called the Path to Youth Justice, that will bring a panel to moderate a discussion about the successes since the passage of Raise the Age and what we can do to ensure both pandemic recovery and protecting Raise the Age against rollbacks from this lens of youth justice. And then CCC is having its annual fundraising event, our celebration breakfast, where we're honoring the New York City Kids Rise, New York City Youth Agenda Steering Committee, as well as the president and CEO of Covenant House International. That information, and to learn more about events, you can visit the events calendar, which is on our website and hyperlinked here. And we encourage you to subscribe to our newsletter, which is being sent out on a bi-weekly basis. And so all you need to do is visit this link, cccnewyork.org/signup, to be able to subscribe and stay up to date on all our events, programmings, take actions, and other products and advocacy work that we are conducting. So with that being said, I want to thank you all for being here. If you have any questions, I think we can take a few minutes to answer them. I know some folks may have to go, so if you do need to leave, appreciate you being here. We'll be sure to follow up with the materials, as well as the different ways you can engage in opportunities that we've been sharing here. So thank you again, and I'll open up the floor again to folks who have any last minute questions. And feel free to unmute yourself. I see Jacqueline. I guess to follow up on your question, yes, Jacqueline, if you're interested, we'll circle back with you. Make sure you send me an email, but I should have your email just in case as well. Yes, you'll get more information about rallies in a follow-up email. So anything that comes from this and that we've shared, we'll be sure to include in the follow-up email. Thank you for being here, Faye. All right, so I don't see any other questions.
Thank you as well. Everyone have a great day.
You too. Jacqueline, yes, let me put my email again in the chat. Okay, Jacqueline, I put my email in the chat, and yes, a recording is going to be shared. So that's going to be in the follow-up email that we sent after this. All right. Well, thank you again, everyone. Enjoy the rest of your day, and we look forward to connecting with you in the future. Take care, y'all.